I contend that a human being should be aspiring to live 120 years. I know that's a bold statement, but it's not pure hyperbole. We need to be targeting ourselves to stay vital. Nothing is ever achieved unless you first conceive of it, men. And that includes going past 100 with your prostate gland in your body. We need to figure out how to live with this instead of biopsying our way into an anxiety frenzy. It's just a horrible thing to do to any man. I'm talking about a prostate biopsy. The hidden risks, yeah, we'll talk about those too, but the obvious ones, it is painful. I don't care what they tell you. It's not a simple, quick procedure. Talk to the men who've had it done. It hurts, and the pain can linger. Another potential risk, infection, no matter if they go through the perineum or through the rectum. And this is a point of differentiation that loses the main focus. Whether they stick the needle through your butt or through the skin between your rectum and your genitalia, the perineum, it's not relevant to the fundamental reflection that it shouldn't be done. No biopsies ever. Other hidden risks, erectile dysfunction, bladder dysfunction, urinary flow issues. You can't stick this trocar. It's not a little needle, guys. It's a trocar. And they don't just go, it's Machine Gun Kelly, baby. They're pumping 12 of those suckers in there. Bad enough, right? Infection, pain, bloody urine, potential obstruction. Men have been hospitalized with abscess, infections, life-threatening level. Men have been hospitalized with obstruction of urinary flow. These are horrible things, not that hidden, but underemphasized. It's no big deal. So many times I've heard this story flow through one of my patients described it as a biopsy annuity. And there's another hidden risk. Now you're on the treadmill. If the biopsy comes back normal, well, we got to check it again. Things could change. Another problem with biopsies, boy, there's a critical study called the PROTECT-T trial that informs much of the reflection upon the futility, uselessness, and harm of prostate biopsies, which we'll get to. But as far as the hidden risks, the ones that they don't tell you about, they make it seem like it's just like getting your car washed. It's just a quickie, in and out, in and out. One of the biggest hidden risks is ambiguity. There's nothing that is definitive about the result. It comes back, there's not cancer. Yeah, but it could be. The reason they did the biopsy in the first place, you had an elevated PSA. Well, it's still going to be elevated. You had an abnormal MRI. Well, it's still going to be abnormal. And guess what, men? Every year we live, the likelihood of developing atypical dormant cells, that's what I call sleeping cells within the prostate gland, it increases. So you're not out of the woods. And if they show evidence of cancer, it does not inform the decision about what comes next. There is not a single screening test, not a blood test, not a genetic test, not a biopsy, that is correlated with a treatment that is shown to actually prevent men from dying of prostate cancer. None of these, everything is based on intuition, speculation, and hope without evidence. Now, I don't mind a lack of definitive evidence regarding an outcome as long as they don't have to hurt you to achieve that objective. Biopsies hurt. And here's a big one, folks. I don't care what they tell you. You stick a trocar, you make a bloody mess out of a cancer, cellular escape can happen. Cellular escape can scatter, can go to other organs, like dandelion seeds blowing in the wind, planting themselves in the bone, in the liver. They will tell you that there's no evidence that occurs, that it's a myth, that it's unlikely to happen, all of which is not true. There's no evidence that it has happened. Technically, that's, I suppose, correct. No evidence, proof, but they've never done the study. They've never done a study to see if it's actually making things worse. I have borne witness to case studies where a man was percolating along, gets a biopsy done, and all of a sudden his PSA takes off. Coincidence? There are research papers in the medical literature documenting a correlation between needle, trocar, metastatic disease. Over 90 of them in the last 5 years, and some of those are related to prostate cancer. There's a case report of a man who had prostate cancer implanted into his rectum after a biopsy. So this is not purely theoretical, guys. It's real. So you've got a man feels great. I feel fine. Yeah, but your PSA is elevated. We better do a biopsy just to see. Stop. There are plenty of ways to look at that gland without sticking a trocar. And I've talked to men that have had never felt the same after the biopsy. This is a major trauma to a vital gland that is central to our masculine well-being. You don't trifle with it without compelling reason. And the biopsy gives us no upside merit. And here's one of the biggest features, one of the biggest reasons I don't like the biopsy. You take a totally healthy man, you biopsy him, you label him, you now have prostate cancer. In almost every circumstance, I would say, that's a gross exaggeration. We're confusing atypical dormant cells, which have some potential to progress, with actual cancer. Those are two very separate things. You take a totally healthy man, you tell him he has cancer. We better take out your gland. Don't you want us to cut out the cancer? Good Lord, the anxiety levels. These poor men are in panic. You poor men are in panic. First thing, stop, breathe, do nothing. Do nothing. You owe it to yourself, to your partner, wife, spouse, friend, family, to maintain your temperance and to really gather information. What we know, so the PROTECT-T trial was published in 2023. That study looked at men who had prostate cancer, and they divided them into 3 groups. These are all men that had biopsies, which, by the way, I recommend you never do. But for the sake of the study, it's informative, and it is really, in my view, the most important study regarding prostate cancer yet published. It should have been a seminal moment of dramatic change in how we approach this process. But it hasn't been. It's been largely set aside. Tomorrow, some poor son of a gun is getting a biopsy. Tomorrow, some poor man is going to stare into the eyes of his urologist and tell him, we have to do something before this cancer gets spread. All right, so here are the facts, guys. The PROTECT-T trial, 3 groups. One group did active monitoring. That's med speak for nothing. You have prostate cancer. We biopsied, proven that. But we're not going to do anything. We're just going to biopsy you periodically and kind of see what happens. Another group got radiation therapy, and a third group had the gland removed. They compared the 3 groups. The goal: does surgery or radiation decrease the death rate from prostate cancer compared to doing nothing? 10 years later, no difference in the death rate from prostate cancer in all 3 groups. None. That was curious. So they said, you know what? Let's push it out to 15 years. We think at 15 years will be a point of separation. 15 years go by. No difference, guys. 0, none, nada. Get the gland removed, a lifetime erectile difficulty, urinary leakage, but no decrease in your risk of dying of prostate cancer. What gives? I give a lot of credit to Dr. Hamdi and the others who conceived of and put forth this study. Now, when I read the study, I looked for who sponsored it. I always do that. Not shockingly, I didn't see any drug companies behind it. It's in their interest to foment anxiety in order to propel, in my view, a lot of harmful and ultimately counterproductive therapy. There's a hidden biopsy risk. You take a perfectly healthy man, feels great one day, now you label him with cancer. You have cancer. It colors his life. It shouldn't. Here's another fact, research-based, from the PROTECT-T trial. The 15-year survival from prostate cancer. Now, the men in this study were not all early stage. Based upon the analysis of the study, 30% of them, well, they were all early stage, but 30% of them had moderate level risk disease. So these weren't all categorized as the utmost simplest forms. Anyhow, 15 years later, the survival rate from all forms of prostate cancer, those that enter without metastatic disease, mind you, we're not talking about men who show up day one with cancer in the bone. 97% survival rate after 15 years. 97%, including the men who did nothing. So take your time. When they tell you this is an emergency, it's not. When they tell you you have to get the gland out before it spreads, that's misleading. In fact, in 30% of the men who had the gland removed, there was already evidence of extension beyond the gland itself. This, gentlemen, is a cellular disease. The hidden risk of the biopsy, in addition to all the trauma, all the infections, all the pain, all the misery, days out of work, days you're not going to fish, days you're not going to have sex with your partner, all those things are relevant. Life is precious. It's short. Each day matters. I don't want you to spend a day suffering needlessly because of a robotic, methodical, intuitive treatment pathway that has evolved over decades without evidence of benefit. It's powerful. I understand what I'm saying. I understand the implication. That's why we've developed the Petteruti protocol. My protocol does not involve biopsies. It does not involve castration. It does not involve blocking your hormones. It does not involve radiation, surgery. The body, our bodies, have a remarkable capacity for self-healing. Your body is actively fighting cancer every day. Does it every day, quite successfully, because we know that cancer is cellular, and we know that these atypical dormant cells reside within the prostate gland behind a capsule. Do not pierce the capsule. Do not stick trocars in there. Listen, guys, if you've already had that done, I do not want to amplify your anxiety. This is a real consequence of the biopsy process. Not only the biopsy, but the way it's interpreted to men. The PSA, the way that's interpreted to men. Your PSA is relevant. We must do a biopsy. Absolutely not. Mark yourself absent. Be mentally prepared. Your primary care doc says, your PSA is elevated. I don't even think you go see a urologist. You know what they're going to say. Like most of them are going to play the same note on the piano. This is what they were trained to do, right? It is entrenched. It's really, really hard to get doctors to change their pattern of doing something. It's been said that if you want a doctor to understand his position is wrong and yours is correct, wait for him to die. They're going to be hard to move. But this evidence, it's there. It's irrefutable. It's tangible. What I'm sharing with you, yeah, it's my opinion, but it's research informed. No biopsy, hidden risk, anxiety. So in the study, the PROTECT-T trial, some of the men in the active surveillance flipped into treatment. Why? They flipped by and large because of anxiety. This is a horrible mental consequence to tell a man, yeah, we think you have prostate cancer. Next question, doc, what can I do about that? Well, We can irradiate you, a ghastly thing you should never do. I don't care if they put seeds, targeted radiation, it's all nonsense. It's all harmful. It's all playing upon your fear and the hope that somehow they can target it. No, these are cells. They're cells. You can't target the radiation to cells. Anyhow, you don't want to have that anxiety, because what happened to the men in the study, a lot of them said, I can't put up with this. Just take it out. Just take it out. If you're that mentally duressed, it may be a reasonable decision, but give yourself time. After 1 year, the men in the active surveillance, the men who did nothing, the anxiety levels tended to go down. And they tended to go down because men started to realize, I'm not dying. Nothing awful is happening. I can stay the course. I can maintain my health and avoid all the consequences that befall following the breadcrumbs down the path of the biopsy. Don't you want to know if you have cancer or not? Yeah, probably like to know that. But most importantly, what action can be taken? And do you need to dig at the tissue to get the answer? Absolutely not. We can make this diagnosis to a reasonable degree of certainty without causing you harm. PSA, MRI, clinical history, and most importantly, get to a health supportive pathway with collateral benefit to well-being without doing harm. So the hidden risk of a biopsy, more numerous than I can count. But I think a big part of this is a psychological duress. I get it. It's an existential horror, right? Someday we're going to die. I like to not think about that. I like to perceive myself as being, like kind of immortal. I don't think it's likely to happen. That is, I do believe that at some point, odds are, based upon my research and clinical experience, that I might die. Although I contend that a human being should be aspiring to live 120 years. I know that's a bold statement, but it's not pure hyperbole. We need to be targeting ourselves to stay vital. Nothing is ever achieved unless you first conceive of it, men. And that includes going past 100 with your prostate gland in your body. We need to figure out how to live with this instead of biopsying our way into an anxiety frenzy. Let me see if there's anything else hidden I can think about prostate biopsies other than the treadmill of misery, the recurrence. Sequential biopsying to see what's going on is absolutely silly. We know what's going on. Your prostate's enlarged. The MRI shows us you have nodules. Okay, let's look at it again in a year, see what it looks like. We got time. You have time. There is no evidence that supports early intervention with any conventional treatment such that it'll prevent you or delay the onset of metastatic disease to the bone or death from prostate cancer. In fact, even when if the cancer becomes metastatic, which in some cases it will do to some people, the majority will never get to that level. But if you get to that level, it's not a death sentence. The majority of men with metastatic prostate cancer to the bone don't actually die from it. There's lots that can be done. So my message to you is, in addition to the futility of the treatment pathway that the biopsy leads you towards, the procedure itself is harmful and inducing of false urgency. Now I get it. Y'all got to live with yourselves. So my opinion should resonate with some of you. And if it gives you the confidence to depart from the conventional stream of automaticity, good. On the other hand, if it doesn't, and you're comforted by going down that pathway, that's most important. What I most hope for you men is that you have choices, how you want to live, how you choose to manage your life. should be giving you flexibility. You should never be forced or told, emotionally coerced, or otherwise misguided based upon false anxiety. All right. So biopsies, no. Why not? I think we've covered that. All right. Listen, guys, thanks for your time. We'll talk again soon. See you then.